The following test is for the grasping and sucking reflexes. Grab a small ball and give this to the child. Ask them to turn it in their hands and observe what they do with their mouth as well as with their other hand. If the mouth and their other hand does not move, that's great because it signals that the reflex has been inhibited. Let's check the other hand as well. Once again, neither the hand or mouth has moved, so there's nothing to do. The grasping and sucking reflexes have likely been inhibited, although we will test this another way as well. Now we will see an example of what happens when the child is turning the ball. It's very common that the other hand would move. This means that the grasping reflex is still present, as the link between the two hands is active. Of course, this may present on the other side as well. Furthermore, the other symptom, which results from a strong link between the grasping and sucking reflex, called the Babkin response, is when the tongue sticks out while they move their hand. This is possible on the other side as well. You always have to wash their mouth when they're using their hands. This may present itself when the child is drawing or writing, and if these reflexes are present, the child should do the relevant exercises. For another way to test this, take a pencil or pen, something that is pointed but not sharp, and draw it repeatedly over their palms while observing what their fingers do. Move from the fingers towards the wrist. If the fingers or mouth do not move, then there's nothing to worry about. The reflex is inhibited. However, if the fingers move in reaction to the pencil, such as this, or sometimes they may even try to grab onto it, then the grasping reflex is certainly still present. If in reaction to stimulating the hand, the tongue also moves, then both the grasping and sucking reflexes are still active. The rooting reflex also belongs to this group. We can check this by drawing small semicircles, starting from the nose down towards the chin. Repeat this on the other side as well. If their expression or mouth does not move throughout, then the reflex has been inhibited and can no longer be triggered. However, if their mouth moves and twitches, or they may even feel ticklish in that area, then the rooting reflex is still triggered and requires exercises to become inhibited.